this? Okay. So tonight is the first webinar in our new Quality of Life series that focuses on personal perspectives. And each of these webinars will feature members of our community sharing their experiences and a doctor or other healthcare provider who can provide the medical perspective. We know that living successfully with your diagnosis takes more than just medications and surgery. It's about living your best life every day. And that often takes knowing other people who have gone through what you are going through. These connections are priceless, and this webinar series is one way we can bring you this information on a large scale, especially these days when we can't get together. So before we go to our panelists, what I'd like to do is introduce Michael Weimer, our President and CEO, to say a few words.
Thanks very much. Great to be here tonight. This webinar is filled with celebrities. You know, Lauren, Peter, Victoria, Dominga are all wonderful members of our various communities here at the foundation. I think we have all fronts pretty much covered tonight. Also, you know, we have a special warm spot for Dominga because some people, maybe a number of people know she's also an employee of the Marfan Foundation. First employee in our history that has actually has Marfan, which is, I think, wonderful for the foundation. And it's great to have Dominga with us. And we also have Katie Wright, by the way, on our VEDS division, who has vascular EDS. But tonight we're going to focus our energies and warmth around Dominga and also our other great volunteers that are with us. We are a lot of things going on at the foundation. As I mentioned, we have a COVID-19 webinar coming up in January. Eileen will talk about that. We have begun to plan for a virtual conference of one type or another. As you probably know, we will not be live this year, although we had hoped to be live in Chicago. That will not happen. We announced that a few weeks back, just not really feasible to do it in the current conditions. But next year, speaking of David Liang, we will be at Hogue out in Southern California, in Newport Beach. And so we look forward to being back together to live at that same point. But, you know, most importantly, let me just wish everybody an amazing holiday season. Vaccines are on the way. Stay healthy, be happy. And Eileen, back to you.
Great, thank you so much. So tonight we have 5 panelists who are amazing. As Michael said, we have Dr. David Liang, who's a member of our professional advisory board from Stanford and Hogue out in California. Then we have 2 young adults with Marfan syndrome, Dominga No, who is also a member of our staff, as Michael said, and Victoria Falcone-Pawar, who is a longtime volunteer, often our go-to on a lot of these webinars. She's a great spokesperson. We also are thrilled to have 2 young adults who have LOEYS-DIETZ syndrome, Lauren Atherton, who is on the board for the LOEYS-DIETZ Syndrome Foundation, which is part of the Marfan Foundation now, and Peter Donato, who was also a longtime volunteer. And I don't even want to talk about the first time that I met Peter because of my age then, and he was probably a baby then, back at that point. So that's our incredible panel. So I'm going to stop sharing this so we can see everybody better. And what I'd like to do is first, let's go to each of the panelists and ask the 4 of you. Can you just briefly tell us, and, you know, when you had your first surgery, was it planned or emergency? How old were you, and where did you have it? So let's start with Peter, because you're top on my screen.
Yeah. So hi everyone. I'm Peter. I had my first surgery planned a month after I graduated high school. So I was 18 at the time. I had it down at Boston Children's Hospital. Yeah.
Right. Dominga, how about you?
So yes. Hi, my name is Dominga. I had my first surgery back in the summer of 2014. It was planned, and it was at Stanford Hospital with Dr. Craig Miller as my surgeon and this guy, Dr. David Liang, as my cardiologist and mom wrangler. So,
how old were you? And how old were you?
I was about to start my senior year of college, so I had just turned 21.
Great. Okay. Lauren, how about you?
Yeah, so my situation was an emergency. So actually 3 years ago from tomorrow, was when I had my open heart surgery, and that's the only surgery I've had. Yeah, definitely an emergency out here in Colorado, so Medical Center of Aurora, and we just happened to have a surgeon on call that day that was specialized in aortic like surgeries.
And how old were you at the time?
I was 20. Oh gosh, I have to do math. I was 28.
Great. Okay,
Yeah,
thanks.
28.
Okay, Victoria, how about you?
Hi, so my first surgery was actually a lung collapse. So that was an emergency surgery, but my open heart surgery was rushed, but it was planned. So it was an emergency that I had to have it soon, but I didn't have to have it that day.
And
I
when
had
was
it
that?
it was a little over a year ago, November 15th, 2019. And I started off before all of COVID happened. So it was very recent.
And how old were you?
I was 28.
Okay, great. Okay. Now we're going to go to David, and I'm not going to ask you how old you are, but we want to get a little, we're going to lay the groundwork.
I'm not going to tell you anyways, okay?
We're going to lay the groundwork a little bit on aortic surgery. So can you just briefly just tell us why people with Marfan and LOEYS-DIETZ need aortic surgery? How common is it? And like, how old are people usually when they have their first one?
Sure. So, well, okay, let's talk about prophylactic surgery, which is what we try to achieve in almost all cases. Lauren and I, sorry, but it sounds like they did a great job. You're here. So, but we, as in case with Dominga and Peter and Victoria, we like to do the surgeries under controlled circumstances because then we can do it much more carefully. The risks are lower. And we decide that, based on a variety of factors, based on what condition you have, whether it's Marfan syndrome, LOEYS-DIETZ syndrome, or one of the other conditions that have hereditary aneurysms, because we have, fairly good data on what the risk level is at different sizes. We also factor other things in, like, what your preferences are, the timing in life, right? Like in Peter's case, he sort of timed, whereas a good break in life where you can take some time out. So we can do that because we can follow things closely. So typically, men with Marfan syndrome will get their surgeries typically in their 20s, okay, late teens or early 20s. Women usually a little bit later, usually in their late 20s and early 30s for Marfan syndrome. LOEYS-DIETZ is a little bit more variable. It's because the condition LOEYS-DIETZ actually really is, many genes involved, and we see a lot more variability within the families. In some parts, unfortunately, it's a little bit more unpredictable. So sometimes we'll operate earlier in terms of the with regard to aortic size and LOEYS-DIETZ syndrome than we would in, let's say, Marfan syndrome. But we have patients with LOEYS-DIETZ who may not need surgery or may not need surgery at all. People get surgery in the 50s and 60s sometimes with LOEYS-DIETZ. But then also on LOEYS-DIETZ, sometimes we'll operate in children. It's very rare to need an operation with Marfan syndrome in children. Typically, it's either young adults that is for Marfan syndrome. And LOEYS-DIETZ, because there's such a variability in the disease, some people will need their operations when they're children, and others won't need it. And actually, there are a few who don't need it at all.
So we have a good panel, pretty representative then. So let me get to our panelists. So let's start with right after surgery. What was recovery like for you? Were you tired for a long time? How long till you felt like normal? Let's go to Victoria first.
So I just want to say thank you to Dominga. She was kind of my surgery expert, besides obviously my amazing cardiologist and surgeon. Asking questions to other people and getting the honest feedback about how you actually feel was a huge thing, especially with recovery. It takes a while. I got married 2 months almost to the date after my surgery, which was remarkable. But if you really try hard, you can be somewhat recovered by that time. But I would say I was probably tired for 3 or 4 months after surgery.
Peter, what about you?
Yeah, so kind of like Victoria, although I didn't get married, about 2 months after I had surgery, I started college. I started my freshman year of college. So, it was definitely a grind at the start to just get back. I spent most of that summer just getting myself back into being able to walk, being able to do stuff, being able to live on campus. So it was definitely a grind. Probably 3, 4, maybe 3, 4, maybe 5 months before I actually was before I actually felt like I was prior to before having the surgery.
Dominga, did you think at one point, okay, oh wow, I feel like myself again? Did that like hit you at a certain point?
Honestly, I don't think it hit me at any particular point. I think it was something that was very much gradual, and just every now and again it was like, okay, this feels good, or this feels normal, or normal, what is normal? But it felt better. It felt better. I think for me, I was in a similar situation to Peter, where I was focusing on making sure I could get back for my senior year of college. So I had a goal, and I think that definitely helped me because it was something to look forward to. Victoria, your wedding, it's something to look forward to. It's something to work towards, and that definitely helped. But even when I got back to school, there were still moments of fatigue. There was like, it wasn't as easy. I went to school in New York. It wasn't as easy to run for the subway at all. But so there was still a lot of recovery time. Even every now and again, when you think you're at a good space, sometimes you just have to step back and take that breath again.
Lauren, what about you? Yours was emergency. So was your situation similar to everybody else?
Yeah, just about the similar timeline. My biggest, when I felt normal, was when I drove. Like I was like, oh, I can drive again. Okay, like freedom. But I would say like normal energy level, probably 3-4 months.
Everybody sounds pretty similar. David, what do you tell patients about what to expect and what they can do to help their recovery?
So I think, this is very typical. And I think what the point is that everybody's talking about fatigue, right? And that's what I tell a lot of my patients is that, and we can ask the panelists what their thoughts are about pain. People worry about pain, but it's really not what most people experience afterwards. I mean, it hurts obviously the first day, and you're kind of sore, but what's different is tired, right? And that's what I tell people to expect. And it comes back gradually, especially the first 2 weeks, right? The first 2 weeks are really tough, and then after that, things start getting better pretty quick. And I tell people by 6 weeks, they're feeling like, pretty good, but they don't have the normal stamina. And it's really sort of that 3 to 4 month period time frame when people start to feel like, okay, I'm, quote normal. Right. And then so that's why I usually tell people, and the biggest thing is like, I think as Dominga said, is having a purpose and getting out and doing stuff. Right. And that's what we really push. And then, I'm sure you remember Dr. Miller telling you 45 minutes twice a day, right? Or 3 times a day, actually. And it's really about getting out there and walking. And what I tell a lot of people is that after surgery, okay, think of getting better as your job. Okay, that's task number 1, right? That means, exercising, eating, and sleeping. Okay, and the goal is to get you better as quick as possible. If you focus on those things, okay, then you'll get your energy back as quick as possible. Whereas some people try to get back a little too early. And what happens then is the whole recovery process drags on. And it just gets tougher. Whereas if you just focus, okay, I'm going to work on getting everything back, especially young people, it makes a difference. I'm surprised you did as well as you did, Lauren, because being prepared for it actually makes a difference. I've noticed that people who have emergent surgery have a tougher time afterwards. I mean, certainly psychologically it's tougher, but then also even physically, it seems like it takes more effort. I don't know. What did you think, Lauren?
Yeah, it was definitely, I would say it was more of an emotional journey because it was, so I had emergency surgery and then I found out I had LOEYS-DIETZ syndrome. And then I found out, oh, you actually have other aneurysms that you may need surgery on. And so I was like, wait, what? When I had no symptoms of anything, no indication of anything. So I would say probably the emotional journey for me was probably a couple of years. So probably 2 years to feel like, okay, I actually kind of got a handle on what just happened to me. But, physical recovery, being tired, that sort of thing. I was exactly what you were saying, where it was like, I just want to get back to normal. I just like checked off the list, like, let's move on. I don't need to worry about this anymore. And yeah, your body definitely tells you when it's time to stop.
So some people asked about the mental process as well. It's not just physical recovery, and also as you move on in your life, but during this post-surgical time or since then, because there's a lot of stuff that you're facing now, whether it's a new diagnosis or potentially more surgery in the future. Do any of you see counseling to get outside help? Do you want to talk about it a little bit, or what do you encourage people? I see Minga's nodding like crazy, so I know she likes this topic.
Absolutely. I mean, yes, absolutely. Mental health, I think, is something that's very important. For me, before my surgery, David, I'm sure can attest to the fact I didn't want to know anything. I didn't want to know. I was like, I'm gonna wake up. Great, cool. That's all I need to know. And it was after the fact that I realized, okay, maybe I should have asked a couple more questions, because then I'm experiencing things within my body that weren't expected. And there is something to be said about how whereas even though your body is better medically, it's still new to you. And I think that for me really got in my head, whereas because I know this is better, but it's not what I'm used to. And that was the beginning of my mental health journey, in accepting that aspect, and then also accepting what actually I went through physically, and learning more details and accepting what happened, and all of what leads up to it. I would say more of the legalese stuff that leads up to it, of deciding who's going to have power of attorney over your medical decisions and things like that. All of that sort of is what really pushed my mental health journey, I would say. There's so much to it.
So Victoria, what about you mental health wise? So did you get outside help, or
So,
I know Dominga was a help too.
She was. And I, this is something that I talked to, I had a therapist, and, and I'm a believer in that. It really helped me, especially, my friends, family, but also seeking outside help. But I have to say, especially what like Dr. Liang said, where a lot of the times it's in young adults or teens that usually have their first surgery. We always think that we're invincible, especially, before and after surgery. So I have to say, like, and this is Dr. Roman was my cardiologist, who I will love to the ends of the earth. And exactly what she said to me before I had my surgery is exactly what happens. You go in feeling like $1 million, even if or you have, my aorta was growing exponentially, but I didn't have any symptoms. You go in feeling like $1 million. As soon as you wake up, you feel like an 18-wheeler hit you. And that feeling doesn't go away for a little while. And when she said it, it scared me, but it was almost better that I heard it, because when you wake up and you don't feel well, you don't freak out, because you're like, this is actually how I'm supposed to feel. And I think that's something, especially in people our age and younger, you think that you're not supposed to feel like this, but that feeling is actually normal.
So Peter, how about from a guy's point of view, like, do you think about, is it different for you, or what would you feel like, psychologically afterwards?
I mean, afterwards, it kind of goes back to what we were talking about in the recovery. Like, you got to grind. Like, it becomes like this is your job. Your job is to recover, especially like in my case, in Dominga's case, in Victoria's case, where we had something going on in the next couple months, like, that we had to get back to, where it's a grind. And I went from being able to walk, a couple miles, around the block, or, down the street, being able to walk a couple miles without any issue, to I could barely get down to the end of my street, 2 houses down afterwards. And it's that kind of toll, to where you got to remember, like, it takes a toll, because like what Victoria was saying, that invincibility, you don't have it anymore. Now you're relearning how to do everything. You're relearning your limits on what you can and can't do, on how far you can push yourself. And it's a grind, it's a grind, and it definitely takes a toll. Definitely took a toll, on me, trying, relearning my limits, relearning what I had to do, and then getting back into college, and now I got to learn figuring out all that. So it's definitely a grind.
Yeah, it's tough. No, there's another part of the mental part, and Lauren and I were talking about it on the phone yesterday, because you still have to watch the rest of your aorta and be monitored. And so just because you had one, it's not necessarily one and done. I mean, you hope so, but you're still being monitored. So I don't know, let's start with Lauren. Do you want to talk about like ongoing monitoring, and how do people in general, who have one of these conditions, it's stressful to go have your echo, because you're just praying that everything's okay. So what's that like especially after you've had a surgery?
Yeah, it's hard. There's definitely scanxiety, is what my therapist calls it, where she's like,
oh, that's great.
is normal to feel
I love that.
anxiety around your scans. And actually this week found out that I'll need another surgery in 2021. So this is just as much for me as getting, you know, like hearing, oh, what's the difference between preparing for surgery versus an emergency surgery? But it definitely, I mean, it's almost like you're waiting to like, someone's waiting to give you permission of like, okay, are you good for another year? Are you like, okay, so you're kind of not sure what's going to happen and you're kind of waiting and seeing. But then it's also, I mean, you kind of, that was a big shift for me was, I mean, I was invincible before I had my surgery. And then afterward, I'm like, wait, so this could happen again? Okay, so now we're monitoring it, that, you know, so it's just a little bit of a reminder of your mortality, if that makes sense, of like, oh, okay. But at least from my perspective, I'm like, well, at least a planned surgery is way better than an emergency. And so
Already done that.
it
You've
gives
already
me
done
like the silver lining.
Dominga, how do you deal with that? Was it scanxiety?
I love that. I love that term. I'm using that from now on.
New hashtag.
I think now I of course I still have that scanxiety. That's not, there's no way to get rid of that. But I will say, I think from having a stronger support system now, because before it was, I didn't want to burden anybody. Whereas now I work with some of the most amazing people who will make it their business, even no matter what the scenario. So I have such a great support system that I feel that if I get to a point where I just need to talk about it, I know I have people that I can go to.
That's right.
And that's where I've really gotten some solace, is just knowing that I have people in my corner.
Good. I want to go to David for the next question. A lot of people asked about going back to exercise after their operation and after recovery or during recovery, or what they can do. And so before I ask you guys, you know, about your lives, I wanted to have David first start talking about, like, what do you recommend after people's surgery? What can they resume? Do they still have the same limitations? Lots and lots of questions from everybody about this.
Sure. You know, it depends a little bit on the condition. Marfan syndrome versus LOEYS-DIETZ syndrome versus vascular EDS. It also depends on whether you've had a dissection or not, and what the residual aorta looks like, because that, you know, determines your level of risk. But let's assume you have a prophylactic aortic root replacement surgery and you have Marfan syndrome. Okay, so the risk of having a subsequent downstream aneurysm or dissection is still there, but a lot less, right? So generally, I'll liberalize things. I mean, there's the immediate recovery period. I mean, obviously, the initial period of protecting the sternum, you know, the first 6 weeks and such. And then after that, in terms of, you know, getting out and walking, for the longer term, you know, obviously relax things, but we tell people still don't go crazy. You're not Superman. We did not build your aorta out of kryptonite or whatever we do. But I will liberalize things. And then, you know, certainly, you know, in the period leading right up to surgery, we tend to be very, very aggressive with medications in terms of, you know, we usually have the blood pressure just high enough so you can stand upright without fainting, right? So we usually back off on that a little bit and let you have a little more blood flow to your brain, okay? LOEYS-DIETZ is obviously a little bit more challenging, and there's a whole range, because some LOEYS-DIETZ mirror more like Marfan syndrome, some have a little bit more fragile vasculature. And so I will probably keep the medication going a little bit more with my LOEYS-DIETZ patients. And I probably, you know, I still will liberalize some, because obviously the aortic root is the most deadly portion. And so once we've got that fixed, you know, if we get an aneurysm afterwards or a dissection, fortunately, you usually don't just drop dead, which is good, which is good. So we, you know, and we have to balance life versus, you know, protecting you and balancing the quality of your life. So generally, we'll relax that. I still probably adhere to the general rule of, you know, mild to moderate aerobic exercise, no heavy lifting that involves any straining. You know, I usually define that by, you know, if you can do it 20 times in a row without straining at the last rep, you're probably okay. If you have to strain at 20, well, lower the weights, okay? And then, so, you know, that's just general guidelines. And then when it's always a negotiation, right? Because we have to weigh, you know, what you like to do, what your desires are, and your quality of life versus, you know, risk to your aorta. And everybody's different, and that balance is probably different for everybody. And that's something that, you know, you should discuss that with your cardiologist or your cardiac surgeon, and figure out, okay, what's a reasonable balance for you and where you are.
So that's great. Let's see how it looks in real life. So Peter, let's go to you. So tell us about what you do And if it's really bad, don't say it out loud. Skip that one. No, just kidding. What do you do about your exercise?
Yeah, so post surgery, went to college. Since I can't play sports, I became manager of the women's basketball team at my school. So I did a lot of work with them in practices. I mostly sat around at the score talk, but every once in a while they needed me as a body to be a defender, be a body that they can run over, stuff like that. But I also did ultimate frisbee. I also did ultimate frisbee, where when I signed up, I said, look, I got to be able to sub myself out. Like, if I get winded, I'm done. Like, there's no, one more point. No, you'll see me sitting on the grass. Like, have fun. So yeah, and then senior year of college, my roommate needed a extra body for an intramural league, and same rules. I told him, I'm like, I'll help you, but I got to sub myself out, and I'm not risking getting run over. And he was like, deal. So that's mostly what I did. I also walked around the city of Boston, a few miles every weekend, or almost every weekend. So definitely, I know my limits. I know my body, so I knew what I could do, where I could go, and how I could do without, as Dr. Liang said, straining myself to the max. So that's
that's important. Accepting what you can do and what you can't do, and taking charge of it yourself. Victoria, what about you?
I mean, that's what, having, one of these syndromes anyway, is you have limitations, and everyone's limitations are different. So exercise was always something that I asked my cardiologist and surgeon about before surgery, because that's always something that people have different limits on. We obviously know no sports, no contact sports, nothing heavy, but it's, what really is the limit. And after surgery, I struggle with that too. I would say I was probably back to somewhat normal of my same workout regime that I had before, about 4 months after. But what you really have to remember is that you're not going to immediately go right back to where you were before surgery. And that was, again, with the mental thing, is that even though I was able to physically handle the workout, my body got tired about halfway through when normally it wouldn't. And you have to just—
What was your workout? What's your workout? Tell us a little bit.
So I do low impact and also some cardio classes. So it depends on the day. But I do like studio classes and bar classes, stuff like that.
Great.
So it's like low impact, but
sorry.
Yeah. But I have to say, like, it's just, you have to, just like Dr. Liang said, if something hurts, or if you realize like, oh, I'm getting winded or tired, like Peter said, you need to slow down and realize like, okay, I'm not where I was before. It does take some time. I would say it took me, I don't know, maybe a good 9 to 10 months before I really felt like myself again, where I was able to do everything that I could pre-surgery. And that's something that I think people really need to remember. Don't get down on yourself if it's not going as quickly as you thought to.
Dominga, how about you?
I was actually pretty fortunate that I had some credits my senior year of college that I was able to play around with. And knowing that I'd had surgery, that I was planning to have surgery, I enrolled in a yoga class and a couple of dance classes for college credit. Performing arts college. What can you do? But I'm actually so thankful that I did, because especially in the chest area, being able to stretch again and being able to feel, because I was so frightened, actually. I was so frightened of being able to stretch and push my shoulders back and really stretch my chest area because of my sternum, that it was really great to have that yoga class, because it got me to be able to stretch again. It got me to feel comfortable with my body. It let me focus on the little things that I wasn't expecting to still hurt or have to need to stretch. And the dance class was the same way. It was allowing myself the movement and they were beginners dance classes, mind you, so nothing insane, but it was one of those moments where I was able to just move my body and let it get back into feeling somewhat normal. And it was really great to have that opportunity. And like Victoria, it took a while. It's just, but again, you sit and you listen to your body and you let yourself, going back to that mental health journey, you let yourself take a break. you forgive yourself for not being up to the standard that you would expect yourself to be. Because if you just expect yourself to just go back 100%, it's going to take even more of a toll on yourself, because you feel like you're failing when you're not. You're just succeeding at a new level for yourself.
Yeah, that's good. Lauren, what about you?
So I, like, pre-surgery, I wasn't super active. So for me, they were like, you need to walk a couple times a day, this many minutes. And I remember having a conversation with my cardiologist, and like months after surgery, because I was like, wow, I actually really enjoy walking. This is kind of weird. And having a conversation with my cardiologist, and I'm like, well, how important is like 45 minutes a day? Like, is that really? And he's like, everyone should be walking 45 minutes a day. And I was like, oh, okay, that's normal. And so for me, I still like struggle with it, because for me, I like keep working and then like not walk. But what I find is like, that's a good time for me to just pause and enjoy the brain break, is what I call it. And just walking, and actually it'll just make you happier. And so for me, walking, and then this year I started using resistance bands, just light resistance bands to work my upper body. Yeah, just walking. And now I find that I love that 45 minutes a day, just to like, nope, I'm going to go outside and walk, or walk on the treadmill.
That's great. So David, some people actually asked, I mean, a lot of great questions, but some people said, well, what if you don't listen to your doctor's orders? And what if you don't keep your monitoring up? And what if you don't follow the exercise regimen that you should, and you push yourself too much? I mean, what do you say to those people?
Bad things happen to you. No, I mean,
That's true.
I mean, I think, so everybody's a little different. I think you should definitely talk to your doctor about it. Our advice is based on, what's worked for our patients in the past. I mean, but it's across the average. We certainly tried, we're basing that, and, everybody's a little different, but, I think there's certain consequences of it. I mean, and I think, our advice based on what works for the most people most times, right? And of course, everybody's different. You can try something different, but there is a potential cost to it, right? So if you push too fast, then, people get pretty darn tired. I mean, that usually gets resolved pretty quickly, because the next day you feel like you've been hit by a bus. So I usually tell patients, okay, if the next day you feel like you've been hit by a bus, well, you push too far. Okay, don't do that again, right? So that one is going to get repeated too often. The ones who don't exercise and just sit at home, it just lingers. It really lingers. The whole process lingers for a long, long time if you really baby yourself. And I think sometimes also, like Dominga mentioned about this tightness in the chest, the staff emphasizes protecting your sternum, okay? Don't overdo it. All right. So, and then just remember that, it was put together with a lot of stainless steel wire. So it's actually not that easy to break it. Don't try. You can, but you have to try, right? And so you don't have to be that tight. And so stretching a little bit, especially after the first 3 or 4 weeks, just loosen up the shoulders and stuff. And because otherwise, you wind up, I mean, I'm sure you all remember, right? The part that was the worst was really between the shoulder blades after
I don't mean to interrupt, but that was one of the things I wanted to bring up, because Dr. Liang, just like you said, how the fatigue is worse than the pain. I have to say the thing that shocked me the most wasn't even the fatigue, because people told me about that. It was the back pain. It was from laying on the OR table.
Well, some of it's OR table. Remember, when you cut open somebody's sternum, the chest doesn't pop open. We have this ghastly device that looks like it's something from the Middle Ages to spread the sternum.
Okay, so they're very happy there are no pictures tonight.
So
this is why I didn't want to know anything before I went into it. I'm good.
Right? This is where about loosening things up. And a massage is wonderful. Okay. And, afterwards, a heating pad, a massage. Yeah. And if you have somebody who's close to you who's willing to give you a massage afterwards, take it, because it's really worth a lot. It's wonderful. Okay. And they're not going to break you. Okay. So a massage and the loosening up those back muscles, wonderful thing to do.
Do you prescribe like PT, cardiac rehab, all that afterwards? So they have like formal exercise after surgery before they get let on their own, and you give them directions?
I think everybody's different is what I usually do. Okay. I think if somebody's motivated and such, and not scared. Okay. Some of the reasons I use, cardiac rehab are one, some people are not motivated. So if I know that they're a slug, okay, yeah, I'll send them to cardiac rehab because then they have to do it, okay? And then other people, especially some people who've had an acute emergent surgery, okay, after they've been through this, you know, they're scared. I mean, one day you were a normal, young, healthy person, didn't have to worry about things, and suddenly, okay, you've had cardiac surgery. And so it's very, very scary. And so cardiac rehab can be wonderful in an environment where you're supervised, where they can guide you, you can feel comfortable pushing yourself. So I think, you know, definitely do that. PT, I use a lot of, okay? You know, especially if we're a little late and the back is really tight, PT is a wonderful way to address that and loosen that up. If somebody has had a thoracic surgery, okay, absolutely, everybody gets PT. As soon as that wound is healed enough that it's safe enough to begin PT, everybody should do PT. Got to get that flexibility back. And so sternotomy, a little less so, but certainly I would say probably about 30% of my patients do wind up going to PT at some point in the recovery process. Highly encouraging.
So generally, if you're not getting yourself active again, you're just going to be tired. You're not going to regain yourself as quickly as you might otherwise. And if you push too hard, you'll overdo it and you'll feel it. Will it lead to like worsening in your aorta and medical problems in the future if you overdo it? People are asking all these kinds of questions.
Generally not. I mean, you know, because usually you stop yourself after a while. Okay, the lesson to learn is you shouldn't keep doing it. All right. You know, obviously, if you're out lifting hefty weights and get your blood pressure up, that's a real problem. But in terms of getting out and walking and being active again, you know, sometimes you just push too much, and you just have to learn and say, okay, listen to your body. Okay, you know, okay, I can push a little bit. I shouldn't push to exhaustion. You know, because then you're going to pay a price.
Yeah. There were a lot of questions about exercise, so I wanted to spend a lot of time on that. There's something else that a lot of people asked about, and I'm going to go to David first to you on this as well, and we'll see if anybody else wants to comment. There are a lot of questions about getting pregnant after having aortic surgery. So I know nobody here has had babies yet. We're not going to ask personal questions, but can David, can you?
I haven't had a baby either. I'm sorry, I can't.
You also haven't probably had aortic surgery either, but anyway.
All right.
What are your recommendations for young women who have had aortic surgery? Not about having a baby or with Marfan or not, but just the mother's side of it, the health side.
What do you mean in terms of?
Like, you know, is it safe for a woman to get pregnant after she has aortic surgery? And are there guidelines for that?
It depends what the state of the aorta is. Obviously, if it's an emergent surgery and still have residual dissection, that's obviously a more challenging issue. Okay, it's not impossible. Okay, but definitely carries more risk, and we're really in sort of an area where we don't have a lot of data on. Okay. But if the aorta is relatively small, I wouldn't forbid it. I would encourage other options if possible, so I get more sleep. In terms of how about if you've had, you know, a prophylactic surgery, and so your aorta is relatively normal afterwards, so the remaining aorta is relatively normal, you know, then I usually tell my patients, okay, there is still some risk, okay? And so if the experience of carrying a child is not something that, you know, something that you have to have, which, you know, I don't understand that, being overweight and sweaty and having to pee every 5 minutes. I'll never understand. I don't have the right set of hormones to do that. But that seems to be something that some people want to do. About half the population of the world seems to want to do that. And so those people, you know, you just have to weigh that, right? But generally, the risk, if you don't have any residual angioedema, the risk is probably pretty low. There are reports of people having dissections in the remaining aorta during pregnancy, even after having had their root repaired. So it's not without some risk, okay? And I think you have to be aware of that. But, you know, we balance life. We're always balancing risk versus benefits. And so if that experience is something that's very important for you, yeah, you know, we'll work with you through the process.
Great.
I can give my personal story with it. So I was diagnosed at 16, and, you know, they always said that it would be, you know, a risk factor, obviously, to get pregnant. So that was always something, you know, 50-50. And then after surgery, you know, I met with my cardiologist. I met with a high-risk OBGYN who is in the Marfan community and a geneticist. And just like Dr. Liang said, it's dependent on the person. And it's kind of like, all they can really say is that you're in a gray area. Even though your aorta is fixed, just like we all know, it's not, your risk isn't minimum, you know, 0 for everything else. So it really is a personal decision that you definitely have to make. But I would personally say, make sure that you talk to all the right doctors. so that you can make the right decision for you and just make sure that you're making the healthiest decision for you.
Does anybody else have anything else to add to that, or you're good? Okay, great. But did you want to say?
Victoria, no, I was just going to say, if anything, Victoria actually has an amazing blog about her whole experience. Sorry, shameless plug for Victoria, but she has an amazing, so she says that I was her surgery sort of guru. She's been my IVF pregnancy guru. And so that's, if you're looking for some information on that, she has an amazing blog that's extremely helpful to find that way that is right for you.
We also have done some webinars on family planning and what different options are, whether you're the one with Marfan or you're the partner. So there's a lot of options, and we've talked about that a lot, and we will continue to do so as we learn new things about it. So so I don't know if everybody saw, but Dominga wrote this great blog post on our blog about top 5 things that she wished she knew before aortic surgery. I wanted, and I keep saying to post some things in this chat, but I'm listening to you guys, haven't done it yet. I will share that blog post again, but let's go to Peter. Was there anything that you wish you knew before surgery that you want to tell people tonight? We have over 100 people listening.
I mean, I've been beating this horse to death on fatigue, and definitely fatigue. If you think you know how fatigued you're going to be, you don't. Like, multiply it by 100. Like, I remember waking up just being absolutely out of it, barely paying attention to the Bruins playing the Stanley Cup on the TV. But fatigue is definitely something that I wish I had remembered or known beforehand, because definitely fatigue, because definitely that is a big part of your post surgery life.
That's great. Victoria, what about you? Anything you wish you knew? I mean, you did have Domingo, so this was good to have a mentor, right?
Yeah, I think there were 2 things, especially one of the things that Dominga did say. I was having a really bad day. One of the days I was getting really sick. I had a really high fever. I was shaking. And then, just like Dr. Lang said, you have to do your breathing and your walking. Those are 2 things that I could tell people. You have to use your breath. Oh my gosh, I forgot the name of it. The spirometer. Thank you.
Yes.
I don't know how I could forget that. My mind tried to block it out. If you do your breathing and your walking, things will be so much better, but you have to remember that you will have bad days. So I think one of the things that I wish I knew before was that even if you have 10 awesome days in a row where you're like, wow, I feel back to normal again. And then the next day you wake up and you feel like you got hit by a bus, even if you didn't do anything too wrong, you're still on your recovery journey and you're okay. You're still okay. You just have to push through it. And that's something that I really like to tell people, is that don't get too down about it. Even though I did on occasion, just remember that you just went through something very traumatic, not only mentally, but physically, and your body is still healing just like your mind is. That was something really good for me.
Great advice. Lauren, how about you? I mean, it was not planned. So now in retrospect, what are some things that you would tell somebody else who's going through that, not emergency, but
I mean, echoing what Peter and Victoria said, just that it's a journey. And yeah, exactly what you said, Victoria, where there would be days where I'm like, I feel great, I'm doing great. And then I'd push, oh, I'll just do a little bit of work, or oh, I'll just check email, or oh, and then the next day I would feel terrible. I'm like, what did I do to myself? And so you see this constant battle, especially as young people, just okay, I need to be patient with myself and give myself some grace, but also, keep moving forward, not just stop where you're at. And for me, I mean, the whole experience was brand new. And so that's where I was like, I didn't know what to expect. And so I think the biggest, what I wish I knew before was just the emotional journey that it would be, and just processing all that, not feeling like I'm a burden on other people, or like being an independent person and then suddenly being dependent. I think that was a big shock for me. I mean, you need help to go up the stairs, you need help to walk, you need help to bathe. I mean, you really feel like a child. Like you're like, I need help with all these things. And so I think being patient with yourself and asking for help when you need it.
Yeah,
that's a great point.
That's an awesome point, Lauren.
David, is there anything else that you tell your patients ahead of time before going into surgery? You're on mute.
So one thing I do tell is what Lauren has been talking about, what Victoria's talking about, is that people expect the physical portion, the pain and fatigue. And I don't know if I don't remember if I gave you the talk, but I usually do. I usually sit down with people, especially just before discharge. I talk about the psychological and emotional aspects of having gone through what you've been through. Even if things are going well, people expect, wow, I just made it to big surgery, you know, I've survived and everything. But there's a big letdown, right? You know, you've worked yourself up to it psychologically, and then suddenly it's just drawn out from underneath you. And so, you know, so it's not uncommon to get depressed. You know, I have a colleague that gives every one of his patients antidepressants after surgery.
Wow.
Because depression afterwards is very, very common, you know, and it's you know, it's what you can't do, but also you know, all the things that you've been through leading up to it and such, it takes a lot out of you psychologically, emotionally. So I always warn people about the possibility of being depressed and having somebody to talk to. And monitoring yourself, I tell the family to monitor people, see how they're doing, okay, you know, and reach out for help if you do think that way. So, you know, the medications work sometimes. They actually work quite well, in fact, for that type of depression, even though it's not, quote, you know, major depression. The medications we give for depression actually help. And actually, they help better even. And they get you over that hump. But, you know, but if anything more, this support from your family and other people. And also, like you said, giving yourself a little break and understanding what's happening. So if you break down and cry, okay, even though everything's going fine, you haven't gone crazy, okay? This is just, it's part of the process of letting your body and mind get back to normal.
That's great. Dominga, did you have something to add?
I did, actually, because this actually has reminded me of a lot of things having this conversation. The breathing apparatus that Victoria mentioned, but along with that, I would say, don't be embarrassed to walk around with your post-surgery pillow. Don't be embarrassed. It is your best friend. Absolutely your best friend. And so, and Lauren, when you said that you started to feel normal when you started driving, for me, it was being able to wash my hair by myself when I started, that was when I started to feel normal. So just those moments where you were saying you have to have other people bathe you and all of that, really just bring cleansing wipes with you to the hospital. Mm-hmm. That's something I wish I knew before, and dry shampoo before before I had my surgery, because it's those little moments where you just need to have little comforts. That those were things that I wish I knew before surgery, was to have those things that made me feel clean, that made me feel refreshed.
Yeah, the little things sometimes, you know, they're really not little, they're actually big.
Huge.
Somebody else asked this really great question. They pre-submitted this. What would you say to your caregivers? I mean, there's a lot of people that are participating that are not actually the person who is going to have the surgery or had the surgery, but they're the caregiver for somebody, you know, the mom, the dad, the spouse, you know. So what do you want them to know? Because, you know, as a like patient who's had the surgery, you know what was helpful to you from your caregivers, and you know what wasn't helpful. So what would you say? Victoria, I'll start with you.
Yeah, I mean, my mom actually took a medical leave for work and stayed with me, and my husband took time off of work as well. So I would say, you know, obviously that's not the case for everyone, but I would say having your people that are going to be there, just like Lauren said and Dominga, you can't bathe yourself. You can't make like when you're thirsty and you need a drink, you can't just jump up and get something. And I saw someone comment that they slept in a recliner. So did I. I went out and bought a recliner. My husband bought me a recliner before surgery. And I have to say, if you guys are looking for something, the recliner was the best way that you can sleep and get up and things like that, because sleeping is very, very uncomfortable after surgery. So I would just say the people taking care of you, just be patient with them And I know I had to have, you know, they really had to push me, because when you're in a lot of pain and you're really tired, I didn't want to take my third walk of the day, and it was winter. So I had to walk around my dining room table. I didn't want to do it, but they forced me to do it, but in a way that I knew that they were loving me and doing it because they knew I had to. So just be patient with us, because we are in a lot of pain, and this is a huge thing, like mentally and physically for us, but just be there for what we need. And also for us to see that they have, you know, it's also hard on us because I couldn't brush my teeth, wash my hair, make my tea. Like that's a huge thing for an adult or a young adult who's so independent. So also just remember that it's mental as well as physical.
Peter, thank you. Peter, what about you? What
Yeah.
would you say about caregivers, and what was helpful and what wasn't helpful?
Yeah, I mean, like what Victoria was saying, it's definitely helpful to, you know, have an extra set of hands around, because like what Victoria said, like I just saw a comment about being thirsty. Yeah, you get thirsty, you get hungry, and as opposed to pre-surgery where you can just get up off the couch, you know, go grab to the kitchen, make yourself a sandwich, and then grab a glass of water. You know, that ain't happening after post-surgery quickly. So having those caregivers around to help with those menial tasks, like making food and help it, or encouraging you to go on a walk. Because like Victoria, I also sometimes didn't want to go for a walk, but my parents and my brother would be like, yeah, let's go. We're going and you're coming with us. So, you know, just having that encouragement is definitely a big help.
Okay. I'm going to look at some of the new questions that came in tonight. I do want to take a second and just say that a lot of people ask very medical questions about the surgery. And obviously we have 4 people who've been through it and only one doctor here, not a surgeon, but we're going to have a lot of surgery talks, and we're going to have some very detailed surgery talks, and we do have some materials. So if we don't get to your medical questions tonight, that's why. I hope you understand, and we will send out, I will post some links in here for you as well while people are talking, but tonight. So let's go to some of the questions here that we talked about rehab already. Let's see what else. David, is recovery harder for somebody who has surgery for the descending aortic aneurysm than what these folks have had? There's a similar experience.
Yeah, so the answer is yes. You know, the incision for descending typically is a thoracotomy. So it involves coming into the side, so you wind up going through more muscles. And so unfortunately that leads to more pain. So it's a tougher recovery because we can't stabilize the wound as well as we can after with a sternotomy where we're just wiring through bones. So there's no question it's tougher. I mean, this is where youth is a big advantage. Old folks like me don't do as well as young people. And this is one where we have to be a lot more careful with people in terms of understanding about their pain, because it does hurt more with that operation. And hopefully your team taking care of you, a doctor taking care of you is cognizant of that. People are worried about taking narcotics. It's okay in that situation because you often need it. And then it's also one where the physical therapy is even more important because we've gone through a lot of muscles. So once the wound is starting to heal and we feel comfortable that it's healed well, we really want to get you into physical therapy to work on the strengthening because the muscles get cut. And then so that oftentimes will result in sort of people sort of splinting and not standing correctly and aggravating the backs, but also adding the flexibility back. So the physical therapy is even more important than that for people who had descending aortic surgeries.
Yeah. Okay, great. A lot of people also asked about diet and nutrition. So I'm curious who on here might have had to change their diet, maybe because of warfarin and look, they're excited to talk about diet. Go ahead, Dominga. Any changes? Is it a problem?
Well, first off, it was actually pretty great in my opinion because Dr. Liang gave me a prescription for Haagen-Dazs and steak when I was leaving the hospital. I remember that absolutely well because you need the iron obviously, and then also getting that fat and getting that back into your system. So honestly, he didn't need to explain it to me. I was just happy to have the prescription. But honestly, I mentioned it in the blog. Food didn't taste the same nothing really, either things were too sweet or too salty. And I'm not exactly sure why. I'm sure David could explain it a little bit better than I can, but that really got into my head a lot. And it also, on top of that, you have a little bit of a lack of appetite. And then I think also something that came into it was because I wasn't able to get up and get it for myself. Part of me was like, okay, then I guess I just won't eat. And obviously that's not the way to go by any means. But that was kind of the mentality that your diet has changes because your body has experienced a lot of trauma, and getting back into it, it took me a while before I could actually feel comfortable eating again and eat on a better schedule, because for a while it was, oh, she's hungry, it's 4 o'clock in the morning, get her something to eat. Whereas then I had to get on a schedule again, especially when I got back to school. It was like, oh no, I'm back on a normal feeding schedule where other people dictate when I'm allowed to, like the dining hall schedule, I have to dictate how I can eat and when I can eat. And so I think it's all of those factors go into how you mentally have to get back into your regular diet, for sure.
Great, thanks. I think Victoria wants to talk about food also.
We're foodies.
I didn't have that experience. My taste buds were, I had no issues with that. I was very, very nauseous for a really long time after surgery. So that was something that I battled with. And Dr. Liang, I'm sure I'm not the only one. So I had not only a lack of appetite, but anytime I would eat something, I would feel sick. And I did get sick for quite a few weeks. So I lost a lot of weight after surgery. So when your doctor tells you that you have to put weight on after surgery, they're doing it because you have to, not because they want you to. So, I had to drink the protein drinks, and I had to, add all these things in. So if your doctors are telling you to do something, you definitely should do it, because in the long run, that's what helped me recover better. So even though I was losing a lot of weight and I wasn't trying to eat, you have to try. And if something doesn't work, try something else. And if that doesn't work, ask your doctor and find something else. So that's something that helped me.
Great. Peter, Lauren, anything else to add on the food topic? No. Okay. Let's go on to medications a little bit. So people with Marfan, LOEYS-DIETZ, or if they know they have it, Lauren, are typically taking medications, for their blood pressure and heart rate stuff before surgery. Are you all taking it still? What's your medication regimen? And then we'll go to David and get the real answer. So Peter, let's start with you.
Yeah, so prior to surgery, I was on losartan, just losartan. I had been on it for 7 years. And then post-surgery, they kept me on losartan and added metoprolol to it. And 7.5 years later, I am still on the losartan metoprolol cocktail.
Okay, Victoria, how about you?
I was on atenolol for over a decade. I was on 2 doses of atenolol. They kind of doubled me. And then as my recovery got better and my, atenolol lowers your heart rate. So my resting heart rate is generally around 48. So when it started dropping into like the low 40s, Dr. Roman was like, okay, I think we go back to 1 a day. So I'm still on that, on atenolol every day, and aspirin every day.
Dominga?
So before surgery, I was on losartan and atenolol. And then after surgery, I just went to atenolol and aspirin. And now I'm currently just on atenolol. So yeah, similar to Victoria's situation, just making sure, oh, your heart rate's really low now. So let's just bring it back up.
And Lauren, how about you? You weren't on anything before, you didn't know you had an issue?
Nothing before, and then afterward, losartan, and then a baby aspirin every day.
Yeah. So David, can you just talk a little bit about why people are taking medication before, and then why they have to continue taking it afterwards?
Well, certainly, the established drugs for dealing with the aortic aneurysms and trying to slow the rate of growth and hopefully reduce the risk of dissections are beta blockers. So they reduce the effects of adrenaline, so your blood pressure doesn't go up as much when you're stressed. Losartan lowers the blood pressure, but also in addition addresses the issues with the biochemistry of how aneurysms develop. And so certainly we recommend at least one. There's obviously some people don't tolerate one or the other, then we use the other. Whether we should be on both, again, is, the data is not that strong for using both, but there is some data arguing for that. So certainly, obviously, if with one drug your blood pressure is still not controlled, then we would certainly add the second. I think there's a lot of room still for knowing exactly what's right. And so I don't think necessarily wrong if you're just on losartan or just on a beta blocker, or if you're on both. I think those are all well within the range of what, is acceptable, okay? And then in certain cases, we will have no drugs at all. But generally, typically, if aortas are heading toward whether you need surgery, well, we probably should have you on something by that time, okay? Afterwards, as we alluded to, is we don't replace the whole entire aorta, right? So you still have your aorta, a good chunk of it. And so we want to protect that as well. And so, that's the reason for continuing the medications to protect the aorta. Like I said, we will sometimes relax a little bit on the medications just because, okay, well, hopefully we've gotten rid of the highest risk portion of your aorta. So if we were, unfortunately, all medicines have side effects. And so if we're, because your aorta was particularly worrisome, we were pushing you to take enough medicine so that you were really even having some side effects, because we're trading that off, side effects versus aortic aneurysm. Once we get rid of the aneurysm, we might back off a little bit and let you relax a little bit so you can actually stand up without feeling faint.
Great. Thank you for that. There were a lot of questions about medication. So for our last question, and then we go back, then we'll finish up with some housekeeping. So today, it's Victoria 1 year past surgery, the rest of you a little bit longer. Are you feeling normal today? Lauren, how about you? How do you feel today?
Yeah, feeling good.
Feeling good. And tell us what you do. So we know Dominga works for the foundation, and Lauren, do you feel like yourself, and what are you busy doing?
Yeah, so I work from home. I'm a graphic designer. I own my own business, which is great. I still struggle a little bit with the drive, I'm just gonna keep going, and the tiredness, just because your body, obviously, you're just kind of, it's different than before surgery. But overall, I feel really good, and it's kind of, life is good. So there's hope. Don't feel like you're gonna be tired forever, or have a shadow over you forever.
Great. Okay, Victoria, she was jumping through the computer to tell us how great she felt. How do you feel, and what are you doing?
I work for a nonprofit in Bayside, Queens, but I'm feeling good. A year after surgery, I was back to where I was. Just like Lauren said, don't get down. If my fatigue is definitely, once fatigue hits, it hits a little bit harder than it did pre-surgery. That's the only, difference that I noticed. But otherwise, if I didn't see this scar, which is very, very light, even a year out, if I didn't see it, sometimes, to be completely honest with you, I forget sometimes that I even had it.
Amazing. Amazing. Peter, how about you? What are you doing these days? How do you feel?
Yeah, so I'm working in operations for a nonprofit medical center down in Boston. Feeling good. 7.5 years. No, 6.5 years post-op. No,
Great.
7. I was right. 7.5 years. I can count. And yeah, feeling good. Every once in a while the fatigue comes, and when it comes, take a seat, and, restart. But we're doing good.
Good.
So,
that's good. Dominga, how about you?
Well, as has been said, I work for the foundation, so I think that contributes a lot to understanding when I need to take a break. But overall, physically, feeling great. Admittedly, though, sometimes there's that mental health aspect that comes in every now and again, and that I saw in the chat, someone asked about mortality and how surgery can affect your mindset on mortality. And whereas physically I can feel wonderful, feel great, the mental health journey is still going. and mortality is a big part of that, and a lot of aspects are from surgery, I would say, are a big part of that. So don't ever think that your mind has to be back to normal, so to speak, because I would say that that's definitely a long journey, at least for me.
Great. David, do you have any final words that you want to say to everybody before we do our housekeeping details here?
Well, I mean, I think, you know, I'm glad everybody's here. And, you know, I think the thing that is hopefully people feel more comfortable with the idea of surgery. And I think the common message to hear is, you know what, you know, get a support group, ask for help. We're here to help you. You know, talk to people, and, you know, because you're not alone, and that makes it much easier. To get through the process, and we're pretty good at it nowadays in terms of getting surgeries done and getting people through it, and so yeah, and just don't hesitate to reach out and ask for help, you know, because that's what we're all here for.
That's great, thank you, and thank you, David, so much for being here and sharing your expertise with us and with everybody. And I thank all of our panelists here. So I am going to go back to my my slides here and just close it all up. And let's just see this here, get rid of my things here. So but I wanted to let you guys know, if your questions were not answered tonight and they're in the question and answer box, we will get them to our nurse in our Hope Center, Jan Lynch, and she will answer your questions. And you can just go to our website, marfan.org/ask, and submit your questions there. And that's the best way to reach her. Again, I did put some information, one of our cardiac surgery downloads in the chat box, so you can download that as well. Also, you know, I know it's so great to hear from these panelists tonight, and you know, we're here to connect you with other people who've been through these surgeries, or anybody else who's had a particular experience related to Marfan or LOEYS-DIETZ or VED. So you know, Jan's a great resource. So, you know, go to that website and submit what your question is, whether it's medical or you want a connection, and we'll hook you up, okay? Because we're here for you. As has been mentioned earlier, our next webinar is on January 14th on COVID and aortic disease, what we've learned. Obviously, every day we're learning something new on COVID, and there's been a lot of research done. And so that webinar is going to be incredible. It's going to be led by Dr. Kim Eagle, who's one of the top experts on this, works closely with the American College of Cardiology. He's a cardiologist from University of Michigan. Dr. Enid Neptune, who's a pulmonologist, who's done these webinars for us before on COVID. She's on our professional advisory board. And Dr. Joe Grima, our Chief Science Officer, and they will take you through the studies that have come out that are related to COVID, and specifically to issues that affect you with aortic diseases and you know, Marfan, LOEYS-DIETZ issues that you might have. Then we have, the following week, we have Dr. Rachel Kuchti from Vanderbilt talking about lens surgery and Marfan syndrome. And then, as I mentioned before, throughout the month of February, we're going to have a series on cardiac aortic surgery. And this will be one webinar a week. David's colleague, Dr. Anthony Caffarelli, is going to be giving one of those from Hogue. We have other experts in that, and that will be coming out, and we'll send you the links to register when we send out our follow-up email with the link to this recording. Everything's going to be at marfan.org. And if you still need some fun masks on our website, you can also get the link to buy some and represent Marfan Foundation, LOEYS-DIETZ Syndrome Foundation, VEDS movement. We got you covered. We want you to be healthy and safe. And finally, in terms of being safe, if you are safely shopping from home on Amazon Smile, as I hope you all are, please choose the Marfan Foundation, and then, you know, whatever you spend, a small percentage of that goes to the foundation, and it all adds up. And then we can keep doing programs like this and bringing you the best experts and all that. So that's all I've got for you tonight. I want to thank our panelists again. This has been incredible. I love hearing from you all, and really appreciate you sharing your experiences with everybody. Thank you, David. And I want to wish everybody out there happy holidays, stay safe, and have a happy and healthy 2021. Have a good night.